एक एपिजेनेटिक्स का नाम लिया तो आपने कहा बहुत सारे कॉमन पर्सन को नहीं पता है, तो डॉक्टर सौरभ बहुत सारे डॉक्टर्स को नहीं पता एपिजेनेटिक्स। ये कह रहा था क्योंकि एपिजेनेटिक्स ऐसा टॉपिक है जो रेवोल्यूशनरी है, जो कि फ्यूचर है, जो हेल्थ का फ्यूचर है। आई डोंट से मेडिसिन का फ्यूचर है, बट हेल्थ का फ्यूचर है। अल्टीमेटली गोल क्या है किसी भी मेडिसिन का, चाहे वो एनर्जी मेडिसिन हो, चाहे वो एलोपैथी हो, चाहे वो आयुर्वेदा हो, होम्योपैथी हो, दैट इज परमानेंट गोल इज हेल्थ। उसके बिना तो कोई गोल है ही नहीं डॉक्टर सौरभ। और जो हमारे दर्शक है, हमारे दोस्त हमारे साथ जुड़े हुए हैं, आपको क्या लगता है? आप हमें चैट बॉक्स में कर बताइए, जो किसी भी थेरेपी है, किसी भी विधि का जो अल्टीमेट गोल है वो क्या होना चाहिए? वो हैप्पीनेस होना चाहिए, हेल्थ होना चाहिए, या नॉलेज होनी चाहिए? तो आई एम वेरी श्योर, मतलब जो आंसर आएगा जो अपने चैट बॉक्स में आएगा वो हेल्थ आएगा। वो हेल्थ आपको कैसे मिलती है, वो हेल्थ आपको किस ढंग से मिलती है? आपको फूड से मिल सकती है, आपको मेडिटेशन से मिल सकती है, आपको अच्छे विचारों से मिल सकती है, आपको अच्छी संगति से मिल सकती है, आपको अच्छी थेरेपी से मिल सकती है। तो ये सारी जो चीजें हैं ये हम अपने चैनल के ऊपर लेके आते हैं हर वीक।
एक इंटरेस्टिंग कंसेप्ट मेरे पास अभी आया डॉक्टर संदीप। डॉक्टर डजंट नो अबाउट हेल्थ, डॉक्टर नोज अबाउट डिजीज।
हाँ।
हमारा जो मेडिकल करिकुलम है थ्रू आउट द एमबीबीएस और जो पीजी करते हैं, डिजीज को आइडेंटिफाई कैसे करना, डायग्नोसिस कैसे करना, डिफरेंशियल डायग्नोसिस कैसे करना, वो अप्रोच ज्यादा है। लाइफ को जब हम समझते हैं, हमारा फोकस जिन चीजों पर है वो बढ़ेगा। हेल्थ पर फोकस पता नहीं क्यों नहीं होता। और जो हेल्थ के पैरामीटर हैं, डॉक्टर बीएम हेगड़े कहते हैं, अगर आपको सुबह जगने के बाद अगर आपका जोश है काम करने का, देन यू आर हेल्दी। नो नीड ऑफ सो मेनी इन्वेस्टिगेशंस। हम जो मेडिकल सिस्टम,
मेडिकल ग्रेजुएट्स होते हैं, उनको कुछ भी चीजों के बारे में बताया ही नहीं जाता, या करिकुलम के अंदर डाला ही नहीं गया है जिसके बारे में उनकी जो नॉलेज है वो वाइड हो और वो समझ पाए कि दुनिया में और भी चीजें हैं, और भी आसमां है इस आसमान के परे। ये बताया ही नहीं जाता है, तो ये बताना बहुत जरूरी है। और ये हमारा जो चैनल है स्पिरिचुअल डॉक्टर फॉर होलिस्टिक हेल्थ, ये इसी का प्रयास है कि हम जो ये नॉलेज है, डिफरेंट जो स्पीकर्स हैं, जो एक्सपर्ट हैं, उनको हम अपने चैनल पे लेके आए, उनसे बात करें, वो हमारे दर्शकों से बात करें, और ये चैनल धीरे धीरे बहुत सारे लोग तक पहुंचे। तो इट्स 11:10।
डायनेमिक एंड चार्मिंग डॉक्टर संकेत हमारे साथ जुड़ चुके हैं। उनके चेहरे को देखते ही खुशी हो जाती है। तो डॉक्टर संकेत, वी वेलकम यू ऑन आवर प्लेटफॉर्म एंड आप अपनी बात।
डॉक्टर संकेत, आपका बहुत बहुत स्वागत है स्पिरिचुअल डॉक्टर फॉर होलिस्टिक हेल्थ। मैं थोड़ा सा अपने दर्शकों को, अपने दोस्तों को डॉक्टर संकेत के बारे में बताना चाहता हूँ। पहली बात, डॉक्टर संकेत इज यंगेस्ट स्पिरिचुअल डॉक्टर जो हमारे चैनल के ऊपर आज आए हैं। डॉक्टर संकेत इज एमबीबीएस एंड ही इज ग्रेजुएटेड इन पीड्स। वो एक ऑस्टियोपैथ है और आर्ट ऑफ लिविंग फैकल्टी है। और बड़ी खुशी होती है जब यंगस्टर्स हैं वो समाज सेवा में आते हैं, दूसरों के लिए जीना सीखते हैं। खासतौर पर डॉक्टर्स तो कमिटेड होते ही हैं, लेकिन इस ढंग से भी जो समाज के लिए कमिटेड होते हैं, ये दिल को बहुत खुशी देती है। और आज हम बात करेंगे ऑस्टियोपैथी के बारे में, ब्रेथोलॉजी के बारे में, और बहुत सारे और क्वेश्चंस रहेंगे। ओवर टू यू डॉक्टर संकेत।
Thank you for such a warm welcome and such a great description about me. And everyone over here, though they may be senior, they're all young at heart, and spirituality is the secret which keeps you all young at heart, right? Okay. So let us go step by step into what is osteopathy, rather than why do we need osteopathy. हमें किसी भी चिकित्सा पद्धति की जरूरत क्यों होती, राइट? बिकॉज एट प्रेजेंट व्हाट वी एज राइटली मेंशन, हम लोगों का अभी तक के जो दृष्टिकोण रहा है वो डिजीज ओरिएंटेड रहा है। मानो कि अगर कांटा नहीं है तो वो फूल है। We have been describing a flower with reference to a thorn. right? And this needs to be changed rather than a new dimension needs to be added to it, right? अभी जैसे 2 दिन से हम लोग सब एक नई रिंगटोन सुन रहे हैं ना कि दवाई नहीं तब तक ढिलाई नहीं, राइट? सबने सुना है ये, एवरीवन? यस, है ना? तो इसको थोड़ा सा रिवर्स कर देते हैं ना, जब तक ढिलाई नहीं तब तक दवाई नहीं. Unless and until till the time we do not break the rules of the nature, keep in tune with the nature, there will be no need of medicines, right? जब तक ढिलाई नहीं तब तक दवाई नहीं, right? It's very simple, straightforward way of understanding. Right? So that's what. So you want to ask, or shall we proceed with it?
You can proceed, Dr. Sanket.
So I'll just start the presentation. Dr. Ranjanji, can you just give the permission to technical one?
Yeah, you are co-host, you can share the screen.
Sir, I would request the permission for technical one by the name technical one.
Technical one. Yeah, got it. Dr. Sanket, can you raise your voice little bit somehow if you can?
Yeah. You mind if I use
yes. डॉक्टर संकेत ने जो अपने बैकग्राउंड में जो कोट लगाया है बहुत अच्छा है. माइंड इज एवरीथिंग. बहुत खूबसूरत, बहुत गहरी बात है.
Yeah, is it better now?
It's better. It's much better.
It's much better. Yeah, it's good for me also. Yeah. Yes. So as you all know, whenever the why is strong enough, we have a good reason to follow it, right? So no doubt, allopathy has its own benefits, right? We cannot deny that part. But over some time, we have realized that instead of popping pills and having a good amount of side effects, also not very conducive for the evolution of the mankind, right? This is what we have been suffering from, or the new thing which has come into our picture. Initially, we thought that allopathic medicine, every pathy has the unique goal of helping the patient to get better. हर पैथी यही चाहती है कि कैसे हम पेशेंट का भला कर सके. उनके सिद्धांतों में या प्रिंसिपल्स में ही अंतर होता है जिससे ये पैथीज अलग अलग हो सकती है, right? The goal is same, to help the person, right? But the way is different, and sometimes we need to change the ways to reach the destination. For example, basic allopathy, the principle is very clean and clear. Law of opposites, माने जो हो रहा है उससे विपरीत करने वाली हम चीजों का इस्तेमाल करते हैं, राइट? एसिडिटी है तो एंटासिड, पेन है तो पेन किलर, नींद नहीं आ रहा है तो नींद आने की दवाई, हाइपरटेंशन है तो एंटी हाइपरटेंसिव, एंड इट गोज ऑन. एंड देन वी रियलाइज कि नो, this is not the way in all situations, right? You cannot always have a stick and hit the child, right? Sometimes you need more compassionate way towards its approach, right? So here it came the beginning of what we known as osteopathy. Like as Dr. Ranjan nicely mentioned, the focus has always been on disease in the curriculum, right? It is like saying agar there is no thorn, that means it is a flower, describing a flower with reference to a thorn. But this is not true. Health is something much more deeper, much more subtle than what just mere absence of disease. And now they have added on so many things to it. The physical well-being, emotional well-being, spiritual well-being, right? Everything comes under the purview of health. So somewhere or the other, this is what we shared yesterday also. This is what my perception was after going through MBBS and pediatrics. I always thought कि हमारा जो purview है देखने का वो यही है कि बीमारी क्यों हुई, कहाँ से हुई, किस वजह से हुई, कौन से ऑर्गेनिज्म से, right? It is same like हमें बचपन में जो पढ़ाया जाता है कि sun rises in the east and sets in the west. But as you go further, we realize the sun never sets in the east, nor rises in the east or sets in the west. It is the earth which is rotating and revolving. In the same way, we need to see things from a different dimension. कि मुझ में, या how can I be the parameter for my health, right? For example, any disease, when it comes, a doctor has 3 questions. For example, if a person after lifting some heavy load, he gets an acute pain of sciatica and he comes to a doctor. Doctor has 3 questions for him. Why this person? Is he obese? Is he not doing exercises? Why this disease? Like, because it's a degenerative case, and why now? Did he overload his system? This everyone can say, right? But where osteopathy comes into picture is seeing at a broader purview of the disease. Like, if that person is a smoker, if he is a smoker, and this is a well documented thing, right? That smokers are prone for degenerative diseases. The effect of oxygenation, the effect of the other systems of the body, which has put an effect and collapsed the system, not only just the symptomatic area of origin, but the whole body, right? Here osteopaths work using their palpatory skills, only palpatory skills, and help the body ease the system and move towards health. And this is what any pathy does, right? Every pathy gives the body the time to heal. Every pathy does the same thing. If the immune system or the healing modality system which is there within us is at a stake, for example, say AIDS may, when everything is at stake, so what happens? A small pneumonia can give rise to collapse. छोटी सी बीमारी हमें बहुत बड़ा नुकसान तक ले जा सकती है. So this is what happens when our immune system or the body's response is not there, right? So going forward to it, this is what Dr. Ranjan initially mentioned, and this is the quote which I would like to share. To find health should be the object of the doctor. Anyone can find disease. एक डॉक्टर का मकसद होना चाहिए कि हम हेल्थ को जानें, है ना, rather than finding a disease which anyone can find. And he is the founder of osteopathy, Dr. Andrew Taylor. Then I would like to add something which is very personal, like being into pediatrics. Pediatrics is a field where every pathy is being used, right? From sound therapy, light therapy, color therapy, and mother's touch, everything is being tried because there is a more compassionate care towards patients, per se, in the field of pediatrics, right? And there onwards, I gained this inquisitiveness and interest, like, is there some more way to help the kids in a more better way? And to be lucky enough, I landed up and I found something which is known as osteopathy. So unless and until we know a little bit about the history, we do not realize that how much pain and sacrifice is being taken and given to establish something which we are getting it so easily, right? In the same way, Andrew Taylor Still, he's the founder of osteopathy. He himself was a civil war surgeon and a physician, plus a frontier. After working for many years and losing his 3 kids of spinal meningitis, उनके 3 बच्चों का death spinal meningitis से हुआ, and he lost his wife also. After that, it was a big trauma for him, and he started questioning the existing modalities of treatment. Though it has drastically changed at the present time, but the mercurials, the opioids, which were being used in those days, he was a firm adherent believer that they are causing more harm than benefit. So after 20 years of studying and practicing and helping patients, he finally came to coin the term osteopathy. And osteopathy has something to do with bones, right? If you take our body, everything is made up of 5 elements. In the same way, the the gross element of our body is the bones, right? The most gross element is the bones. He believed that every disease has its root cause in the bones, right? Instead of focusing outside in, he focused on inside out. कि अगर कोई बीमारी आती है तो उसकी जो जड़ है ना, उसका जो कारण है, that is there within us. External factors do play a role, but if the internal system is strong enough, we can cope up with many of the things. It's like fire engineering versus civil engineering. You need fire extinguishers at points when they're needed, but if the civil engineering, the interior is so strong enough, the foundation is so strong enough, the needs are definitely less, plus we get a better quality of life. So he was the first one who founded this, and after that, I'm happy to share almost 25% of the new admissions in the alone of US are towards osteopathy rather than the allopathic school. So they contribute now to the 20%.
Again, Dr. Sanket.
I'm happy to share that in US alone, 25% of the new recruitments are in the osteopathy school and not in the MD school. They have a big proportion. And you may be aware that recently Dr. Trump, when he was diagnosed of COVID, his treating physician was also a DO, not a MD. So it was a very nice thing for people to become aware of something like this. Yes, Dr. Sandeep.
This is done after graduation in allopathy, or anyone can do that osteopathy, pursue that osteopathy, and doctor can pursue, or any person can pursue this path.
Yes. As for now, the master's program in osteopathy, which is a 2 years program, or a 2.5 years program now onwards at Sri University, the eligibility criteria is a MBBS student, a physiotherapist, or a dentist, or an Ayurveda practitioner. All these 4 streams can apply for it and give the entrance exam and crack it. Along with that, those who are interested in learning osteopathy can learn directly after 12th standard as a 4.5 years course. As we have MBBS, we have DOs. So the BOs, which will be coming in India.
In USA, the qualification is the same. The system is same. As you have discussed, near about 25% people are pursuing that osteopathy rather than allopathy.
Yes, the curriculum there differs only that they both study in the same time duration. After 4.5 years, 1 year extra is being dedicated by the osteopathic school students to have their hands on in the medical school. The curriculum, rest all remains the same. Along with the medicines, they have an upper hand of the living anatomy and using a hands-on techniques.
Thank you, Dr. Sanket.
Yes. So what makes this pathy? So this is how it is. Like, it is recognized part of the WHO in the traditional medicine or the complementary medicine, and it's all around the globe. It's all around the globe. It is said the best of West has now come to the East. Like, it is the best kept secret, which is osteopathy, which has now come to India for all of us. With the dedicated efforts of the whole Faculty of Art of Living and, of course, His Holiness Shri Ravi Shankar. So the question, which it still has many answers for me too, and it's always remained a wonder for me. Always remain a wonder for me that what is osteopathy? This is a question which has walked me since the time I have not even joined it. What is osteopathy? What is osteopathy? It's like similar to asking what is health, right? The definition keeps on changing, but some things are similar. The same way, osteopaths are professionally qualified, highly skilled healthcare professionals who see the body as a whole. Every pathy has its principles in the philosophy, which makes it so special, right? In the same way, seeing the body as one whole unit and not as a compartmentalization. For example, if the lung is affected, definitely my diaphragm or the musculoskeletal system needs to be worked. Or the cranial system needs to be worked. So for understanding purposes, very clear, I'm making myself very clear over here. For understanding purposes, we divide the body from gross to subtle into three systems. First is the musculoskeletal system, the visceral system, and the cranial system, right? Simple analogy, fan ke blades, andar ki motor or electric current, right? You have a machine, there is an engine to it, and there's electric current. In the same way, your musculoskeletal system, the organ system, and the cranial system. Though the system which may be complaining not necessarily have the cause in it. Usually, doctors still used to give the analogy. अगर आपने किसी बिल्ली के पैर पे पैर रख दिया तो आवाज गले से आएगा and your whole focus is on the throat region. If you put a leg on the cat's tail and you're searching where the voice has come from. So this is the analogy which was given in those times, right? And this is clearly true. Instead of focusing where the symptoms are, we need to find the root cause of it and see where it is actually coming from. Acidity, one of the very common issues which people face, right? We need to see the complaint is within the organ system, but is there anxiety, is there irregular food habits, or very importantly, what is the alkaline system of the body doing? The liver, is it at a fail? It is not doing its work properly. What is there which is harming the system and not allowing it to proceed further? Looking at a patient as a person. This is the whole journey from patient to person. Looking at him as a person, not as some labels of diseases, right? And this is the second principle on which the osteopathy relies, that is structure and function are interrelated. Here is where such a detailed understanding of the anatomy comes into picture. As earlier we were mentioning regarding a couple of Nobel Prizes, in the same way, I was so amazed to know in 2020 Feb, there was an article published for receiving the Nobel Prize for cracking the mystery of how the hair gets gray. जो बाल सफेद या ग्रे हो जाते हैं, what is the mystery behind it? They have cracked it finally, and it is not the adrenal axis. It is not to do something with the kidneys or anything else. It has its roots in understanding the sympathetic and parasympathetic imbalance. It has its roots in that, and that is what they have told and well researched and documented thing, which is one of the founding principle of osteopathy, that everything is based on anatomy. If there is a structural change, there has to be a functional change, which we all have experienced. If there is a fracture, the structure is lost, the function is definitely lost. And after keeping the hands in the cast for a long time, the function is lost, so structure automatically is deteriorated. And when we don't lose our muscles, our systems in a proper way, that function is deteriorated. Which brings us to all the diseases which are at a later stage, but at the earlier stage, it is not feeling well, not getting up early, and all those symptoms which are early markers of poor health. You don't feel healthy, right? Health is an expression of self, right? A Hindi word for health is swasthya, right? Established in the self, right? And this is where we all have a common platform. All spiritual doctors or any alternate or the main system of the medicines which come into line is body has a self-healing mechanism, and we all rely on that. So the question is, why do we fall ill? And this mechanism is so supreme, it is so profound, then why do we fall ill? In a daily life, whatever stress we face, let it be physical, emotional, familial or unknown, किसी भी कारणवश जो हमारे शरीर में तनाव आ जाता है ना, stress and strains which are being accumulated in our body create some distortions in the anatomy of it. That is where the healing modality, the life force which is driving within us, does not flow and does not heal us properly. Here comes the role of osteopath. After taking a detailed and meticulous history and examination, we focus on detecting and finding by palpatory methods the different rhythms of the body. Here it is where it is different and unique from other modalities, right? For example, any report, if we say, for example, some common blood report, there is a value for hemoglobin, there is a value and there is a range given to it. If something is in range, we say it is normal. If it is outside the range, we say it is abnormal. In the same way, we have many rhythms in our body, just like meridians. Dr. Ranjan is an expert in it, and it is very easy for him to find out where is the meridian going from, and he is an expert in it. It will take a huge amount of study for me to, if at all I have to learn it, right? In the same way, by using palpatory skills, an osteopath is trained to detect the different rhythms of the body. Let it be your musculoskeletal rhythms, your cranial rhythms, or your visceral rhythms, and see which is not moving in the same direction. It is very simple analogy. If there are 200 people dancing and everyone is supposed to do the same step and one person is not doing it, is it not easy to figure him out? It is easy to figure him out. We just need to have that awareness, attention, and that knowledge. And by using some gentle hands-on technique, we bring that part to its normal and let the body do the work, right? So this is how we work.
डॉक्टर संकेत, कुछ लोग हमारे साथ डॉक्टर्स नहीं है, तो can you elaborate how osteopathy work and how osteopathy diagnose the thing, and what is a palpitation method?
Palpitation method, yeah, very true. So how does any medicine works? It relies on the body's potential to heal itself. कोई भी दवाई कैसे काम करती है, उसका रिजल्ट हमारे शरीर के अंदर जो रिएक्ट या रिस्पॉन्ड करने की क्षमता है उस पर भी निर्भर करता है. Two persons having the same symptoms, taking the same medicines, get different results, or we put the other person out of the picture. हमें ही कभी-कभी सेम बीमारी के लिए अगर दवाई लेनी पड़ती है तो कभी-कभी उसका असर बहुत अच्छा होता है, कभी-कभी तो बिल्कुल ही नहीं होता, और कभी-कभी तो ज्यादा दवाई के बाद भी नहीं होता. तो शरीर के ऊपर फोकस करने वाली चिकित्सा पद्धति को हम लोग ऑस्टियोपैथी कहते हैं, राइट? तो जिस तरीके से आज हम लोग एज द वे वी रिलाई ऑन द इन्वेस्टिगेशंस एंड एग्जामिनेशन फॉर डायग्नोसिस, हम क्या बोलते हैं कि दिल का बीमारी है, उसका हमको इको में कुछ मिला, और देयर इज सम चेंज ऑन द एक्सरे फाइंडिंग्स और द सीटी स्कैन. वी रिलाई ऑन द इन्वेस्टिगेटिंग मोडालिटी एंड से which organ or system is compromised, right? In the same way, osteopath, we use hands-on techniques. जैसे कोई खाना पकाता है या कोई कपड़ा व्यापारी है, उसको कैसे छू के पता चल जाता है कि this is the good quality of cloth and this is not that good quality of cloth. In the same way, by using hands or palpatory skills, an osteopath comes to find out कि हमारे शरीर का कौन सा हिस्से की मोबिलिटी या उसकी हलचल ठीक नहीं है या कहाँ पे कोई गड़बड़ी चल रही है, और उसको जानकर फिर उनको वापस अलाइनमेंट में लाकर ठीक करते हैं, सेटिंग द एनाटॉमी बैक टू इट्स प्लेस. एंड इट इज, एंड एज यू सेड, this is on a one level, it is very true for making it simple to understand, and rest all, it's all quantum physics which you said is the new thing. Now I think Dr. Sandeep ji, should I add something more?
Yes, it's enough. It's enough.
Yeah. Yeah. So this is how everything works in the purview, and focusing only on the cranial system, the cranial dimension comes under the purview of craniosacral treatment or craniosacral balancing. So that is a different offshoot of osteopathy. William Sutherland was the person who developed cranial osteopathy and later on craniosacral.
Can you a little bit elaborate on craniosacral? What is meaning by craniosacral?
Yeah, craniosacral. Yeah, yes. Cranium means the top part of the head. This is the top part is the cranium, and sacrum is the lowest part, जो हमारा tailbone है, जो हमारा tailbone है, that is known as the sacrum. These are the two extremities, the top end and the lower end. Everything, a body is 70% fluids, right? 70% is water. So water component is there in a body, which is clearly evident, right? In the same way, we have craniosacral fluid, the CSF, the fluid which is there present throughout the system. And when there is imbalance, मान लो आपको एक हाथ में 10 लीटर का बॉटल है और एक हाथ में 2 लीटर का बॉटल है, right? And if you are lifting it, right, definitely you will be shifted to one side because there is the imbalance, right? All your right side system will be at a torse, there will be torsion, इसमें हमेशा compression रहेगा, right? Balancing that systems and bringing it back to the normal in the equivalent state, that comes under the purview of CST. There are similarities and there are differences, right? It depends on how we see it. For example, an apple and a banana, right? They have the similarities and differences. In the same way, cranial system, it will focus mostly on the fluids, and the cranial part of it. Osteopathy will add on to it, including cranial part plus the organ system and the muscle part. And our body is the living dynamism, right? If I could show you this, it's very clearly evident. ये बचपन में हम लोग सबने किया है. I don't know. Have you done this? I'll share this. If you keep your hand in front of you this way and notice how far your hand is going, and it's a pledge लेते हैं ना. If you keep in the front of you and see how far it goes, right? As if you're touching the screen, right? As if you're touching the screen, you know how far it is going easily, right? And if you just fold your hand this way, okay, and you start rotating the tissues from here in one direction, you just rotate it. Yeah, skin to skin is good enough. Okay, and then you again say it, you will find कि हाथ 1 सेंटीमीटर भी छोटा हो जाता है. Were you able to appreciate it? If anyone? Achha, how many of you were able to do it? Let me check here.
We can
demonstrate again.
Video was very small in comparison to screen, so
yeah,
we can.
Now it's better.
Yeah.
So it's very simple and very profound way of doing, right? अगर हम लोग हमारा हाथ सामने रखते हैं, right? अब ऐसा सीधा, if you keep it and just see how far you can reach the middle finger, right? Without much force, you keep it. Your spine is erect and everything is erect, right? You can see how far. If you have a bottle or something, you can keep it as a benchmark. कि भैया मेरा ये bottle तक के हाथ पहुंच जाता है, right? So that you know, because it is a small 1 centimeter variation which you will get, right? And then you use your other hand and you start rotating the tissues, right? In one direction. Start rotating it 3 times. Very softly you rotate it, right? And then you see it again. इसमें थोड़ा सा अंतर आ जाता है. Ideally, one should go to the wall and see. So it comes. You can practice it, try it. Hand is short now, like, so it is a bit shorter now, right? So it is very clearly evident because this is a living anatomy, right? Our living anatomy works on principles which are different, right? Now imagine if there is lack of fluid or any small tissues, or muscles are 75% fluids, right? If they are shortened at a particular place, will it not affect the nerves coming through it? क्या उसमें से जो वायरिंग सिस्टम हमारे शरीर का चल रहा है उस पे नहीं होगा क्या इसका असर? सभी चीजों पे इसका असर होगा. The subtlety, spirituality is going to the subtlety, right? In the same way, osteopathy is going to the subtle things of a body from where we can treat it and bring it back to normal. Now, just you will shake your hands and reverse the direction of your twist, it will automatically happen. Even if you don't do anything, just give it few minutes, it will come back to its original length. ठीक है? तो बोलेंगे डॉक्टर संकेत सबका साथ छोटा-छोटा कर दिए. So this is the way.
One question is coming, Dr. Sanket. How osteopath works? What is the modality? Because in medicines, there are medicines, there are surgery, there are different things are there. But what is the instruments osteopath uses to treat the patients?
Yeah, this hands are the only instruments. It's like going from a landline telephone to a smartphone, right? So as you use your only this hands without any coin box system, you use only hands. That are good enough. These hands are the eyes of the osteopath. By knowing this, we can use it. By knowing the tissue texture change which is there. Say if someone has a heart issue, definitely T1 to T4 or the upper part of the back is also constricted. There's a tissue texture change. There's a difference in the temperature. Plus this asymmetry is gone, right? So by using our hands as a palpation, using for diagnosis और फिर alignment को ठीक करने के लिए हाथों का ही इस्तेमाल करते हैं, and that brings the system back to normal. It's very, what you say, it's very subtle, effective way of helping the person.
वे जानते हैं उनके लिए समझना बहुत इजी है डॉक्टर संकेत, लेकिन कुछ लोगों के लिए ये समझना भी हाथ के साथ में आप पूरा जो CSF फ्लूइड है आपका, CFS फ्लूइड है सारा, उसको कैसे चेंज कर सकते हैं, कैसे उनके अलाइनमेंट कर सकते हैं. इट्स वेरी डिफिकल्ट. कैन यू लिटिल बिट एलैबोरेट एंड शेयर फ्यू एग्जांपल्स ऑफ योर पर्सनल लाइफ?
या बिल्कुल. देखिए मैं एक एक्सपीरियंस के तौर पे इसे शेयर करता हूँ. देयर वाज दिस लेडी, शी वाज अ बैंकर, है ना, वो एक बैंकर है और उनका 10 साल से शिकायत रहा है कि उनकी गर्दन हिलते रहती है, जिसको लोग टिट्यूबेशंस कहते हैं. इट कीप्स ऑन मूविंग लाइक दिस continuously for the past 10 years almost now. This was the complaint which she came from, right? After visiting every doctor, हर किसी डॉक्टर, न्यूरोलॉजिस्ट हो गए या हर, you name it, and they have went to almost many majority of doctors, right? Physiotherapists also, and everyone not to be excluded. And then finally someone told, and they came to us for osteopathic treatment. I was surprised to know, and she was even more surprised that one single thing which was the root cause of her illness was she used to work in bank and she had to look up this way. This way she used to look up, just this way, every time this way. नीचे देना है, ऊपर देना है. So this was causing a good amount of torsion. This regular activity for more than 15 years was causing the torsion and tension in the body, which had repercussions in the other systems also. Through this release, she got better almost 80% after the first treatment, and she was like, this is the best day of my life. We just celebrated the whole day because this was the first time after 10 years in my life I had this day where I was not shaking, I was not feeling dizzy. So how you treat it? This is what I'm saying. We treat it by bringing the alignment to its normal. Like if you need to understand, जैसे आपने झाड़ों को पानी दिया और वो तो ठीक हो गया ना, they started blossoming, right? जैसे पाइपलाइन होती है, if you direct the pipes, automatically the water is directed. You don't need to direct water directly. In the same way, by setting the body structures to its normal, the automatic self-healing takes the upper hand and brings it back to normal. Okay, just experience it this way. Okay, it's very simple to experience. Okay, now suppose you have to take a deep breath. You have to use your lung. अगर हमारे lungs का पूरा क्षमता का इस्तेमाल करना है, and if you are sitting this way, you close your hands this way, you bend on yourself, and now bend your neck also down, and now you take a breath in and release. Okay, now you have noted कि breath लेने में क्या difficulty था. Now you just loosen up yourself, कंधों को ढीला छोड़ देते हैं. Lift up your shoulders and take them back by lifting and taking them back. Now you take your breath in and breathe out. There is a difference. There is a clear-cut difference in it. Unless and until the structures at a proper place, the lungs. Now, हमारी lungs में कोई खराबी थी क्या? Were our lungs at fault? No. What happened is the musculoskeletal system, the posture was compressing it. This is what happens in asthma patient. They have usually elevated heads or the diaphragm is not working. So यहाँ पे आपको ऑस्टियोपैथी के माध्यम से शरीर की अलाइनमेंट को ठीक करके मदद मिलती है, right? And even more, if you can go backwards and see, it will expand even more.
You are elaborating, Dr. Sanket. बहुत सारे क्वेश्चन ऐसे आ रहे हैं, शायद सबका आंसर नहीं दे सकते हैं, लेकिन एक दो क्वेश्चंस हैं, उनको मैं कंबाइन करके पूछता हूँ. कुछ जो दर्शक हैं, दोस्त हैं, वो ये जानना चाहते हैं, क्या स्किन डिजीजेस भी ऑस्टियोपैथी से ठीक हो सकती हैं?
Yes, anything can be treated, helped in the treatment depending on what is the disease, what is the cause, right? For example, in skin disease, definitely liver and other toxins, other systems also needs to be worked on.
Still, क्योंकि most of the doctors are trained in medicine and we all use our left brain more. So still they are unable. How without any medicine one can be treated, and how with hands you can align whole body and disease can be healed?
Yeah, it's very simple. Like after, like, just imagine 10 years back, someone saying ki I'll transfer money from this phone to that phone, from my account to your account without going to the bank. He would be made the joke of, right?
Exactly.
But now everyone knows like this is possible.
Even 40 years back, अगर वो कोई 40 साल पहले इस दुनिया से कूच कर गया है और आज आके देखे भाई अमेरिका बात कर रहा है, ये तो यहाँ बैठा बैठा और सामने फोटो भी आ रही है, तो it will be miracle for him. It will be something very unusual. Same thing is that.
Same thing. Like my mother, like she shared with me, like we are so surprised to see you kids working on this cell phone, and initially we used to think that there is a wire going from this to that end and they are receiving it. Like this was the innocence, right? I had this innocence in my still कि टेलीविजन के अंदर ही गोविंदा बैठा हुआ है, अगर आप पीछे से देखो मान लो उसमें दिखेगा. Like I used to feel this. That was the innocence. Like this was all the question. I didn't know this.
Really got that. Beautifully, Dr. Sanket. बहुत अच्छा आपने इस बात को समझाया सबको. जो क्रेनोसैक्रोथेरेपी के कोई और क्वेश्चन हो, किसी दोस्त का जानना चाहता हो, और आप थोड़ा सा कुछ ऐसा हैंड ऑन एक्सपीरियंस बता सकते हैं जो क्रेनोसैक्रोथेरेपिस्ट होता है, जहाँ ऑस्टियोपैथ होता है, वो किस तरह से काम करता है? जो पेशेंट होता है वो लेटा होता है, बैठा होता है, कैसे उसको हैंड से उसकी एनर्जी या अलाइनमेंट करता है? कैन यू एलैबोरेट लिटिल बिट ऑन दिस फील्ड आल्सो?
Yes, sir. So as पहले सब हिस्ट्री जैसे, हिस्ट्री is a very important part, because history is a very important part. It takes almost half an hour to 40 minutes for getting into history, because we know कि sometime or the other everything is related. एक बीमारी आती है, फिर ठीक हो जाती है, फिर दूसरी आ जाती है, and it's a vicious cycle which goes on. Then we have some exercises or tests which are being done by the patient, like sitting test, standing test, and to see whether the body में symmetry है नहीं है. अगर जैसे अभी फॉरवर्ड बेंडिंग करने को बोला तो आपका सिर घुटनों तक टिक रहा है कि नहीं टिक रहा है, whether your hands are touching it or not, which part of the lungs is breathing more or not. It is one what the person experiences, and then we go on direct hands-on examination. We see the spine. For example, एक पेड़ की जो टनी होती है ना, एक जो पेड़ की शाखा होती है, वो अगर ताजी है, it's when it is a new one, and you just press it, you have a spring action to it, right? It will recoil back. That is a life there is there. It is, if it is very hard enough, it has no life force in it, it will not move freely, right? In the same way, the spine column, when the vertebrae are at strain, they don't move. They are very stuck to each other. We feel those things by our hands, and when the person is lying down, we use some techniques. For example, this is very this you want to experience, you can experience. Now this is based on the principles and philosophy of osteopathy, right? So this is not osteopathy. It's like a dentist saying how to brush your teeth, but that is not dentistry, right? Dentistry is totally different, right? So in the same way, what we can do is we can just keep our palms behind the on a head, okay, this way you can keep it, and the thumbs just below the earlobe. There is a dip just behind the jaw, right? Okay, just behind the jaw. Okay, and if you keep on extending the elbow, okay, and now without moving the head, if you see to your right side and then see to your left side, one side you will find that it is moving less. One side it is moving less. Okay, now just remove your hands. Okay, without much efforts, look to left side and look to right side. One side is easy, figure that out. Can you figure that out? Yeah, everyone has a little bit, not very chronic, a little bit of, right? So now remember which side it was difficult for you. जिस तरफ आप कम देख सकते थे वो note down करना. For me it was left, right? I was not able to see much on the left side. Okay, so
right.
हाँ, तो बिल्कुल आपके लिए right होगा. So just put your hands again and your thumbs are below the jaw line. ठीक है? Your elbows are extended. Your hips are relaxed, your navel is relaxed, your chest is relaxed, and you look to your left side or the side which was difficult for you. You keep looking there to your elbow. Without moving the head, you just keep looking to your elbow. For 20 seconds, we'll be looking there. 19, 18, 17, 16, 15, 14, 13, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Just close your eyes. Just swallow the saliva. Take a deep breath in and breathe out. And slowly you may open your eyes. Now again look to left and right and then bring your hands down. Now we will again check, right, whether this worked for us, how much. Look to your right side and look to your left side. For me it has increased. To left side it is much easier for me. Is it the same for some of you?
Yes.
Yeah, so this is something which, yeah, increase. Yeah, see, so this is what हमारा गर्दन नहीं झुकता है, ये नहीं झुकता है. So we need to appreciate and value that life force in us, right? This body is such a precious gift. It is not just carbohydrates, proteins and amino acids. It has a life force, that thing which is in us, which has the mechanism to do everything. Its potential is tremendous. We have not just looked into it. It's like believing in the moonlight but not the sunlight. हमने अभी तक तो moon की light है, we believe it, but we don't believe in the sunlight. So that is something which we need to tap into, like the gravity, the nature which is there within us, which has this potential of helping us from the subtlest to the gross.
Great, Dr. Sanket, आपने इतना beautifully जो practical हमें experience दिया, that was really amazing. एक मेरा क्वेश्चन और बहुत सारे दोस्तों क्वेश्चंस आ रहा है, तो बीच में हम एक तरह से जो इंटरवल होता है वो हम इंटरवल लेके उसका ब्रेथोलॉजी के ऊपर हम जाएंगे. आपका सफर स्पिरिचुअलिटी में कैसे स्टार्ट हुआ, कैसे आप इंक्लाइंड हुए, कैसे आप इस रास्ते पे चले, शुरुआत कैसे हुई और किस चीज ने आपको पुल किया?
हाँ जी, बिल्कुल बिल्कुल सही. जैसे बिलोंगिंग टू अ मारवाड़ी फैमिली, पूजा पाठ, दान धर्म, ये सारी चीजें तो होती रहती थी. It was always there a part of it, right? And always there was something which was there कि करना है, भगवान का करना है. I was very this kind of person to believe, but I always question कि यार और तो कुछ होगा ना, ऐसा थोड़ी है. Why is everyone करते समय टेंशन में क्यों रहता है? Why is it the same? So in my MBBS times, in second year, I joined this workshop, basic course happiness program उस समय, just because मेरे सारे HODs जो थे, teachers जो थे, वो लोग उस कोर्स को कर रहे थे. To be in their good books, I joined this workshop. है ना कि यार उनके साथ रहेंगे, you know, MBBS times हमें होता है ना कि हम पास हो जाएंगे, टीचर्स के अच्छे नजर में रहेंगे तो अच्छे नंबर मिलेंगे, right? So this was my basic intention. मेरा स्वार्थ था कि नहीं यार उनके साथ तो लगेगा कि बच्चे अच्छे रास्ते पे चल रहे हैं, and so I just joined the workshop, right? and I found it something good. जो मेरा short temperedness था, जो मेरी understanding थी why a person behaves in this way, why a person is not behaving the way he should, controlling the mind, ध्यान देके पढ़ो, ध्यान देके करो. This all was taught in the workshop, and I continued my practices of breathing, pranayama, and of course meditation. Right? Then the research was published in the British Journal, which showed the effect of breathing exercise and Sudarshan Kriya on serum lactate, thyroid, and all parameters which were there. I was knowing कि okay ठीक है, this something good, and I enjoyed the satsang part of it. So I thought कि चलो satsang भी जाया करेंगे, and we keep on practices. There were selfish gains to keep me in spirituality because things were happening. I became more luckier. I got good marks. I was good at relationship issues. Parents के साथ में सब अच्छा चल रहा था. So that gave me more selfishness कि यार सब कुछ अच्छा चल रहा है, सब कुछ अच्छा चल रहा है, तो क्यों छोड़ना चाहिए? And बनिया क्यों छोड़ेगा? When there is a gain in it, why would someone leave it? Right? But there was something more to it. There was something more to it that was helping people coming out of it. मेडिकल फील्ड में मुझे सबसे बुरा तब लगता था जब डॉक्टर बोलते थे ना कि you could have come earlier to me, है ना, आप हमारे पास पहले आ सकते थे तो would have done something. This is a movies में भी हम लोग सुनते थे सब चीजें. At that point I realized कि now it is, देखिए ना, पिछले आप मुझसे ज्यादा अनुभवी हो, पिछले कुछ सालों में 20-30 सालों में पहले 4 गली में एक डॉक्टर होता था, अब गली में 4 डॉक्टर है. 8 गली में एक मेडिकल शॉप होता था, अब गली में 8 मेडिकल शॉप्स. फिर भी लोगों की बीमार होने की संख्या बढ़ती ही जा रही है. Still people are falling more and more ill. Is it something we are at fault or something else, right? So here my inquisitiveness about spirituality, about dimension of healing modalities became more and more stronger. No, I want to learn something to help people. And I continue my practices, and with guidance of His Holiness Shri Ravi Shankar ji, timely it fall in place. Now, if I look back to my career, how after doing pediatrics and learning osteopathy, I still wonder how it all happened. While learning for osteopathy, my faith in osteopathy was not that much to begin with. I just thought it is an add-on skill which will help me treat my pediatrics patient. But after seeing a child who was a boy, a grown-up rather than 21-year-old, जिसको बचपन से ही left-sided hemiparesis था, जो खुद का काम भी नहीं कर सकता था, has to use support all the time with the power of just 20%. When he got well after 3 settings of and the treatment which he received, the power was almost 80%, and till today he has not lost anything, right? So that one thing, being a pediatrician, knowing the school or the line which a person follows, and helping him in such a way which was not there earlier in my hands, right? That changed my purview of looking at patient, from patient to something much more, right? Something much more. And that is how it all matched with spirituality and osteopathy. It all came at one place. And then I became Art of Living faculty to help people gain more interest and come out of disease towards a more better quality of life. Because there are many who are not having any disease, but still they are unhappy, right? It's a very different thing. So to bring this essence of spirituality, we have given them this art of living and osteopathy.
सुपर एंड कांग्रेचुलेशंस, आपको बहुत मुबारक. और मैं चाहता हूँ आप जैसे डॉक्टर्स और हों जो इस तरह की सोच रखते हो और जो डिफरेंट ट्रांसफॉर्मेशन लेके आ सके पूरी सोसाइटी में, एक नया कल्चर डेवलप हो सके जो हीलिंग का है, जो एक हेल्थ का है. तो हमने बात किया डॉक्टर संकेत अभी भी ब्रेथ के ऊपर, डिफरेंट रिसर्चेस के ऊपर. तो हमारा जो नेक्स्ट पार्ट है वो है ब्रेथोलॉजी. तो उसके बारे में हमें थोड़ा सा बताइए.
Yes, very true. So this is for the first time like we are going into this depth of breath with regards to anatomy, right? Breath is very important, right? ये हम लोग सब जानते हैं कि एक तरफ आपको जो चीज चाहिए है ना, एक तरफ what is the most precious thing which you want in your life, right? At one side, you have that multiplied by 25 times, and other side, you have breath. Which one will we choose? Intelligent wise person will choose by jaan hai to jahan hai, right? So breath is so important. We all know this. For all practical purposes, breath is synonymous to life. हम बोलते हैं भाई कि उसमें श्वास नहीं है, and we check the CPR and all those things which we do. श्वास नहीं है मतलब जीवन नहीं है. So breath and life are synonymous, right? We know little aspect about breath. We have little knowledge about life also. The first thing which we do in our life is breath, and the last thing which we all will be doing is breathing out. Breathe in and breathe out. But still, this breath is a very untapped secret to all the problems or all the modalities or diseases or going to be healthy. सभी के लिए breath का बहुत important role है. अब breath के साथ साथ there is one word like which many of us are aware, that is prana. है ना, prana या chi or energy, whatever we say it is associated with breath, but not only breath, right? For example, जैसे एक bird है और उसके wings है, right? The whole bird is considered to be prana, and the wings are the breath, right? So they are component of prana, but not the whole prana. For us to exist, there is gross to subtle, sharir, shwas, man, buddhi, chit, ahankar, and self, right? Gross to subtle. For keeping it simple, body, breath, and mindset. And a mindset, it has 4 things in it. So the connecting link between the gross and the subtle is breath. When we are angry, our breath pattern changes. When we are happy, our breath pattern changes. And you'll be surprised, our ancient text of Patanjali Yoga Sutras, it mentions about 9 obstacles and 4 signs of illness. One of the sign is irregularities of the breath. This is one thing which is clearly evident in all the illnesses which we have. So, by tapping into the air component or the health through breath, we can regain health in a much better way. And this COVID time has proved it even more, had further, what you say, stamp laga diya is baat ke upar ki na, your breathing potential, your breathing capacity are very important to be healthy. So 90% of body toxins are flushed out through air, and we use 30% of our capacity. To understand this in the scientific terms or something which we can understand, मान लो आपके पास एक आलू है. If this is a big aloo, right? And there are 2 machines kept in front of you, and you have to make उसमें से chips बनानी. You have to make some potato chips out of it, right? You have to make some chips out of it. In one machine, if you put that potato, it will give you 32 chips, right? With no wastage, right? In other machine, it will give you same size, only 2 chips plus this much plus a good amount of wastage. First machine 32 chips, second machine only 2 chips. So which one will you put your potato in?
32 pieces.
एक पोटैटो से आपको अगर 32 चिप्स मिलेगा with no wastage, and other part you get only 2 chips and remaining is wasted. Which is the better deal for us? To get 32 chips, right?
Obviously 32 chips.
Yes, this is very obvious. In the same way, our body runs on energy. Energy ka currency is ATP. ATP ka source is all the carbohydrates, all the molecules which we have. When one glucose is broken down to the first machine, that is aerobic oxidation, you get 32 ATPs. When it is broken down in presence of anaerobic oxygenation, lack of O2, you get 2 chips plus a good amount of CO2. So that is why, plus lactic acid, the waste which I was saying. So कितने सारे लोगों को हमको सबको कभी ना कभी जीवन में होता है, अच्छा थोड़ा दर्द आ रहा है इधर, सुबह उठने बाद में stiffness लगती है, we don't feel fresh. This is why the toxins, the CO2, the lactic acid, all that is being metabolized in absence of a good amount of O2 or a good circulation gives rise to the problem. Here comes the role of breath. Sitting on the source of energy, sitting on the potential of energy, we need to tap into it by using this mechanism to the fullest. The lungs, I think, एक जोक होता था पहले ना कि the unused brain, जिसे ऊपर रीसेल लगा था brains का, so one brain, Einstein's brain was the cheapest and some common other one's brain was expensive because it was unused, right? So in the same way, we need to use our lungs, right, and not give it as a resale value, right? We have to use it fully so that it gives us the best. So here the anatomy comes into picture, right? How it will help us is like how one should breathe, right? This is the most important thing, which if one knows this, many things are sorted in life, right? So we all should know if there is a problem with us so that we can easily rectify, right? So if we keep one hand on our tummy and one hand on our chest, एक हाथ हम लोग पेट पे रखेंगे और एक हाथ छाती पे रखेंगे, मतलब नाभि के हिस्से पे एक हाथ रखा और छाती पे एक हाथ रखा, with eyes closed, just observe and take a breath in. Observe what comes out first, tummy or the chest,
Chest.
and what goes out. Yeah, so it could be tummy for some, it could be chest for some, right? It could be both coming synonymously or synchronized, right? Ideally, according to the ergonomics, the diaphragm, जो हमारा primary muscle है, below the, जहां पे हमारा rib cage खत्म होता है, वहां से लेके, so this region, there's a diaphragm, is a big muscle like an umbrella, like, तो जैसे हमारा छाता होता है ना, तो कैसा ऊपर नीचे जा सकता है. In the same way, diaphragm goes up and down, up and down, up and down to gives us breath. So ideally, the diaphragm, जो हमारा primary muscle of respiration है, that should work first. So थोड़ा सा tummy and then the chest. This is how you should go according to ergonomics. अगर ये नहीं होता है तो क्या दिखता है हमको? श्वास लेना हम लोग कम कर सकते हैं क्या? नहीं, right? We breathe 24,000 times in a day, right? Now imagine, this is a very common example which I figured out in this lockdown, है ना? Homemaids, जो घर पे काम करने वाले हमारे maids होते हैं, helpers होते हैं, right? दो, एक है जिसके पास आपने काम दिया है to clean the house, and the other one is who makes the food, right? दो लोग हैं, right? This is very simple analogy which I am sharing. एक है जिसके पास में घर साफ रखने का काम है और दूसरा है जिसके पास में खाना बनाने का काम है. Both are equally important for a day home house. If one goes on leave, मान लो जो घर की साफ सफाई रखते हैं वो छुट्टी पे चले गए, and only one maid is coming, right? Only one person is there to help you, and she has to do all of the work. उसी अकेले को सारा काम करना, एक दिन, 2 दिन, 3 दिन, 4 दिन. Will she not complain?
ओवरलोड हो जाएगा.
ओवरलोड हो जाएगा. Yes. Now उसके ऊपर ओवरलोडिंग का प्राइमरी कॉज किधर है? जो दूसरा छुट्टी पे गया है ना? अगर वो छुट्टी पे नहीं है, दोनों लोग साथ में काम कर रहा है, सो चीजें थोड़ा सा स्मूथ चलेगी. देयर विल बी नो हिकअप्स, नहीं आएगा, तो नहीं होगा. इन द सेम वे, अगर हमारा डायफ्राम ठीक से काम नहीं कर रहा है, स्टिल आवर एक्सेसरी मसल्स आर बीइंग यूज्ड. इसलिए कंधे चढ़ जाना, गर्दन में पेन आना, नेक में पेन आना, दिस इज क्लियरली एविडेंट. It has to be there. And if you go on pressing this, neutralizing this, without going to the root cause of freeing the diaphragm, it won't solve the purpose in the long run. किसी का टेंशन कम करना है, किसी को काम पे लगाना है, and to gain that balance and to bring them in harmony so that it balances the whole system. This is what it is. Setting the rhythm back, right? जब आपका पेट नीचे जाएगा, so the pelvic floor gets strengthened up, and the lungs will expand, and same is with the head region. Here going to the fineness comes in the osteopathic purview of breath. कि is the pelvic floor का strength है क्या, chest में कितना strength है, पोस्चर में कितना स्ट्रेंथ है, एंड हाउ इज द हेड, द क्रेनियल सिस्टम इज वर्किंग. So this is what we need to understand and use the gift which are being given, right? The breath of life, right? It is the prana, the energy which we have, and breath is the source to tap into that.
The question is how much time tummy breathing to be done from Smith Gupta.
Yeah. Ideally, it should happen on its own, right? But when you are doing it, awareness, like we have to train it, है ना? We have to train it. So बचपन ऐसा cursive handwriting के लिए we need training, right? Only changing the pen will not improve the handwriting. In the night time, if you keep one hand on the tummy, one hand on the chest, and see if the tummy is expanding without stretching the back, without arching the back, so that the whole is expanding, plus the chest is expanding, right? So this will, or the yogic breathing, which is sometimes told, or the abdominal breathing. So 10 times if we do it, long deep breaths in and out with a balance. सांस लेने से आपका sympathetic system आता है, सांस छोड़ने से parasympathetic system का balance बनता है. So it stimulates it, right? The circadian rhythm which we all. So ये 10 बार भी अगर हम लोग करेंगे, तो this is what benefited many people, including me, the sound sleep which we can get, and plus we can relax the system rather than using it, right? In quantum physics, as Sandeep ji mentioned, they are working like zero, like I need to go to right side, I need to go to left side, but what if I try to do both together? It will not be possible. But this is possible in quantum physics. Both 0 and 1 position is possible. That is the superposition, right? And by just doing sympathetic and parasympathetic balance, we can bring the system in that position of rest where the body can use its best footage.
Yeah, Dr. Sanket, there are few compliments for you. One compliment is about your analogies. The analogies you have given about the potato chips, the house worker, help, and other, they are so beautiful that it's easy to understand for everyone. Second thing is that, as usual, I have seen in Art of Living faculty, your smile, charming nature, these two compliments are coming in between. I thought I should convey these two things to you. Yes, Dr. Sanket.
It needs a wise and intelligent person to notice this, all right? So all of this loving people over here, or spiritual doctors and people who can appreciate this thing, right? Look at this better thing about it. So breathing, yes, you can do, and smile is the first sign of health. Then pediatrics mein na, because I've worked there, I can always give this example. My teacher used to say, the first sign that you need to discharge a baby or a child from the ward is his smiling. He gains his smile back, that is the first sign of health. Okay, your sympathetic system come, parasympathetic is dominating. You can now let him move
एक
forward.
बात तो है डॉक्टर संकेत, I want to say that जब भी बेबी डिलीवरी होता है तो दो लोग होते हैं, गायनेकोलॉजिस्ट होता है, एक पेडियाट्रिशियन होता है. तो आपकी थोड़ा सा शक, आपका चेहरा देख के, स्माइल देख के बच्चों को ऐसा लगता होगा मैं सही जगह पे आ गया हूँ, दुनिया अच्छी.
यस, भाई वो मुंह खोल ले, थोड़ी सांस जाए तो मेरे अंदर और भी सांस आए.
राइट. ग्रेट डॉक्टर संकेत, ये आज एक ऐसा सेशन है जो बहुत ही एनर्जी भरा है, बहुत सारे क्वेश्चंस आ रहे हैं, और इतने क्वेश्चंस आ रहे हैं, लगता है 1 घंटे में या सवा घंटे के लिए हमें भी बहुत मुश्किल होगा. एक दो क्वेश्चंस ऐसे आ रहे हैं, जैसे ने सिंपैथेटिक एंड पैरासिम्पैथेटिक की बात की है, तो आपने ब्रीथ इन ब्रीथ आउट की बात की है, तो इसमें अनुलोम विलोम या नाड़ी शोधन जिसको बोलते हैं, उसका क्या रोल है ब्रीदिंग में? इसके बारे में हमें थोड़ा सा बताइए.
हाँ जी, बिल्कुल. जैसे अनुलोम विलोम या नाड़ी शोधन प्राणायाम, या जो रिसर्च होके हमारे पास वापस इन अ पॉलिश्ड फॉर्म में कार्डियक कोहेरेंस ब्रीदिंग करके आया है, हाँ, इसका नाम ये दिया है. इट हैज अ वेरी नाइस इफेक्ट ऑन बैलेंसिंग बोथ द सिस्टम्स. इट्स लाइक लेफ्ट ब्रेन इन द राइट ब्रेन, लेफ्ट ब्रेन इन द राइट ब्रेन, और you can say always activity and rest. Life is a combination of rest and activity. And that is what we use. If we keep on activity all the time, we need to rest it. If we are resting all the time, still we need to activity, right? So taking long deep breaths from one side and exhaling from the other, taking breath from the one nostril and exhaling from the other nostril, it has a soothing effect. So it is said now there are 72,000 nadis in our bodies and they are being purified. That means a good flow of energy comes into them by doing Anulom Vilom or Nadi Shodhan Pranayama. It is the basic practice, like hand washing before eating or doing something, Nadi Shodhan before any practice. Beginning and end, खाना खाने के पहले और खाना खाने के बाद दोनों समय हाथ धोते हैं. In the same way, Nadi Shodhan helps. And experience speaks more, right? There are many benefits. Once people start doing it, they will realize it even more.
Exactly, I totally agree with you. हम जो अगर ऑस्टियोपैथी की बात की है, हमने चाहे ब्रीदिंग की बात की है, चाहे अनुलोम विलोम की बात की है, ये ऐसा है मेलोडी खाओ खुद जान जाओ. एक बार आपको इसका एक्सपीरियंस करना चाहिए. अगर चाहे आप क्रेनोसैक्रल थेरेपी ले रहे हैं, आप अगर जानना चाहते हैं हैंड के साथ में आप कैसे ट्रीट कर सकते हैं, तो वन हैज टू एक्सपीरियंस दैट, क्योंकि ये ऐसी चीजें हैं जो हम चाहे इसके ऊपर पूरा दिन हम डिस्कस करते रहे, अगर हमारा लेफ्ट ब्रेन उसको रोक के बैठा हुआ है, उसको हम अंडरस्टैंडिंग में लेके नहीं आ सकते हैं. लेकिन एक बार हमने रसगुल्ला खा लिया तो हमें रसगुल्ला समझाने की जरूरत नहीं, रसगुल्ला क्या होता है, तो खा लेगा, समझ जाएगा. It's very difficult to tell someone what is रसगुल्ला अगर इसने देखा नहीं है, खाया नहीं है. I think ऑस्टियोपैथी और ये सारी जो एनर्जी हीलिंग की मोडेलिटीज है, ये एक्सपीरियंस वाली चीजें.
Very true.
Right? And
डॉक्टर संकेत, टमी ब्रीदिंग से रिलेटेड आप कोई प्रैक्टिकल कराना चाहेंगे?
टमी ब्रीदिंग से रिलेटेड, ओके, ठीक है.
और सम मेडिटेशन एक्सरसाइज और सम मेडिटेशन, व्हाटएवर यू फील.
या we'll do some breathing and then meditation easily. We can quickly go through it, right? Example, it was very, as you mentioned, right? So lungs hai, there are 3 lobes for it, है ना? The lower, the middle and the upper part for it, right? So what we can do is, जैसे हम सब लोग उड़ना चाहते हैं, we have that feeling of freedom. Spirituality is what, like the basic essence is belongingness and freedom, right? जहां जाए वहां अपनापन लगे, सब लोग अपने ही हैं ये माने, और वहां पे हम लोग freely रह सकते हैं, right? Though wearing formals, we can be informal, right? So this is what it is, feeling home wherever we go and with that belongingness. So if we keep our hands at this position, right? Sharir, yeah, just by the sides, and just take it back and forward, like flapping the wings. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. This is for the lower part. There are many more asanas and pranayama which many of us know and practice, but still with a smile, if you breathe in and breathe out in this region 10 times, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Now here in this part, पीछे आगे 90 degrees पे. Breathe in, breathe out. Breathe in, so it won't harm anything, right? बस मुस्कुराते हुए करेंगे, so the body will respond even more, right? In this position, and then we take back. We are using trapezius muscle as a way to touch. जैसे पानी को पकड़ने के लिए you need a vessel for it, right? In the same way, we need a handle for it. So we are using the musculoskeletal system का handle. Hold the breath, right? And relax. Just shake up. थोड़ा सा हाथों हिला लेते हैं, right? By just moving also we can keep talking. So like as Ranjan ji mentioned, we need to experience some part of meditation, right? So we will experience meditation, no doubt. But what is meditation? Meditation is that art of doing nothing, that rested and alert state, right? जो हमने बात किया ना, superposition वाला, है ना? That is the point where everything gets sorted, right? So we'll be rested and aware. So there are 2 things. एक है धारणा और एक है साधना. Sorry, एक है कल्पना. One is धारणा and कल्पना. When I say you apple, जैसे अगर मैंने कहा एक सेब के बारे में सोचो, तो आपने सोच लिया ना. That is your simple धारणा. You get what I am speaking about. But if I say you उसका इमेजिनेशन करो, विजुअलाइजेशन करो, है ना, और उसकी कल्पना करे, तो उसके आप एफर्ट्स में चले गए. लाल है, हरा है, कश्मीरी है, कोरोना वाला है नहीं है, कहाँ से आया है. So all those efforts goes into the धारणा से कल्पना की ओर. So हमें कल्पना नहीं करनी है, हमें धारणा करनी है. We'll just follow the instructions what are given from here, right? ठीक है.
Friends, now after coming out of this tamasic nature, जो डॉक्टर संकेत ने हमें एक्टिविटी के थ्रू कराया, now we will go into meditation. If you want, you can switch off your lights, you can switch off your cameras also.
ये आंखें बंद कर लेते हैं. परिसर में हो रही आवाजों के प्रति सजग हो जाए. Become aware of all the noises coming in your surroundings. किसी के बोलने की आवाज, गाड़ियों की आवाज, जो भी आवाजें हो रही है उन्हें स्वीकार करें. एक साधारण सांस ले और खाली कर दे. One more joyful breath in and breathe out completely. Your body is a precious gift from the divine. हमारा शरीर कुदरत से दी गई एक अद्भुत भेंट है. इसे सम्मान करें. Honor and respect your body. अपना ध्यान मन ही मन अपने दाएं पंजे पर ले जाए. Take your attention to your right leg. Right knee. Right thigh. And relax your right leg completely. दाएं पैर को ढीला छोड़ दे. Take your attention to your left leg, left feet, बाया पंजा, बाया घुटना, बाई जंगा. पूरे बाएं पैर को ढीला छोड़ दे. जनेंद्रियों पे अपना ध्यान ले जाए. नाभि का निचला हिस्सा और उसे भी ढीला छोड़ दे. अभी करने को कुछ नहीं बाकी. जस्ट रिलैक्स. कमर, पीठ का निचला हिस्सा, इसे भी ढीला छोड़ दे। मुस्कुराते हुए एक सांस भरे और खाली कर दे। पेट और नाभि के पास के हिस्से को ढीला छोड़ दे। छाती और पीठ, इसे भी ढीला छोड़ दे। दायां कंधा, पूरे दाएं हाथ को ढीला छोड़ दे। मुस्कुराते हुए सांस भरे और बाएं कंधे को भी ढीला छोड़ दे। पूरे बाएं हाथ को ढीला छोड़ दे। ना ध्यान अपने गले पर ले जाए और उसे भी ढीला छोड़ दे। गर्दन, चेहरा, जीभ, होठ, गाल, आंखें, मस्तिष्क, सिर की चोटी, सिर के पिछले हिस्से को भी ढीला छोड़ दे। पूरे शरीर को ढीला छोड़। मन में जो भी विचार आ रहे हो उनके प्रति सजग हो जाए। अच्छे विचार हो या बुरे विचार हो, उन्हें स्वीकार करे, उन्हें आने दे, ना रोके ना टोके। Whatever thoughts are coming, just let them come. Just relax. Become aware of your feelings. शरीर में जो भी भावनाएं उठ रही है उसके प्रति सजग। सुखद या असुखद भावनाएं, जो भी भावनाएं हैं उन्हें स्वीकार करें, अभी उन्हें आने दे, ना रोके ना टोके। Just let go all your efforts for now and relax. Even the instructions, just let them go. You are peace, you are love, you are joy. आप प्रेम हो, आनंद हो, शांति हो. लोका समस्ता सुखिनो भवन्तु. लोका समस्ता सुखिनो भवन्तु. ओम शांति शांति शांति. Become aware of your feelings, if any. अपनी भावनाओं के प्रति सजग हो जाते हैं. अपने विचारों के प्रति सजग हो जाते हैं. एक और लंबी गहरी सांस ले और मुस्कुराते हुए खाली कर दे. शरीर और वातावरण के प्रति सजग होते हुए एक और लंबी और गहरी सांस ले और उसे भी पूरी तरह खाली कर दे. और धीरे धीरे जब भी आपका मन करे अपनी सुंदर सी आंखें खोल सकते हैं. Taking your own time, gently may open your eyes.
Wonderful, Dr. Sanket. It's so beautiful.
Dr. Sanket, this was really very peaceful meditation. I think everyone in this group right now, we are near about 80. Everyone must have enjoyed this deep, relaxing, and peaceful meditation. Friends, every week we are coming on this channel at 11 a.m. on Sundays. If you like this session by Dr. Sanket, please share with your friends, with your other social groups, so that this session can reach to many persons, and whoever listens that, he or she can be benefited. Dr. Saurav?
Yes. Thank you, Dr. Sanket, for such a lovely session. आपकी स्माइल का तो
जादू है।
एक क्वेश्चन और है डॉक्टर संकेत, with your permission, so many persons are asking about your phone number. I don't know, they want your phone number for treatment, or they think that you are married or unmarried. So,
I'm thinking the same.
you share your number in the group with your permission.
Yeah. Please. You can share via. No issues.
I'm just joking. I know that so many persons, so many doctors are curious to know about osteopathy, and so many were asking about, is there any crash course of 7 days of osteopathy? So they want to ask personally from you. You can guide them if someone wants to take sessions.
Yes.
And with me is Dr. Nidhi also right now. Dr. Nidhi को अभी screen पे आपने देखा था. Dr. Nidhi is also pursuing craniosacral therapy. वो भी art of living teacher है. She is a radiologist from Bathinda, Punjab. Dr. Nidhi, आपका experience कैसा है craniosacral therapy के बारे में? अभी आप सीख रहे हैं और आपके जो टीचर हैं वो भी बहुत renowned teacher है craniosacral therapy के. आपसे भी हम थोड़ा जानना चाहते हैं सर.
Yeah, thank you Sandeep, and thank you Saurabh for giving me this opportunity to share my experience, because I'm a doctor और मुझे पहले बिल्कुल भी ऐसे नहीं लगता था कि CST कुछ ऐसा कर सकती है, बट मुझे किसी ने ये कह के ज्वाइन कराया कि you will improve your health, because I was going through a bad phase of my health. मैंने सोचा चलो ठीक है मैं करती हूँ ज्वाइन, and when I reached for my first seminar to Rishikesh, it was like मैं इतनी थकी हुई पहुंची थी, मुझे लगा मैं नहीं कर पाऊंगी, but after 5 days I was like a 20-year-old. मेरा एनर्जी लेवल इतना ज्यादा अप हो गया था, and it's beyond words. जैसे अभी डॉक्टर संकेत ने कहा ना कि रसगुल्ला समझा नहीं सकते, आपने कहा कि वो नहीं समझा सकते क्या है, but CST भी ऐसा ही है. It's a miracle to the like mankind, I would say. हमें लगता है कि हाथ लगाने से क्या हो जाएगा, but it is आपकी जो बॉडी का जो इनर हेल्थ है वो एक बार दोबारा से रिस्टोर हो जाता है. सो आई कंप्लीटली एग्री विद डॉक्टर संकेत, और मेरा मन था कि मैं ओस्टियोपैथी भी ज्वाइन करूं, बट देन आई केम टू नो कि ओस्टियोपैथी का कोई क्रैश कोर्स नहीं होता है. सो इट्स ओनली यू कैन फिजिकली लाइक अटेंड. सो मैं तो कहूंगी कि जो भी डॉक्टर्स हैं इसको जरूर एक्सपीरियंस करें CST को, और अपने पेशेंट्स के लिए भी जरूर कहें, बिकॉज इट्स अ really a blessing to mankind. And it was a very nice session, Dr. Sanket. I really loved the session, loved your smile, loved your way of expression, and thank you Dr. Saurabh and Dr. Sandeep for bringing Dr. Sanket to this platform so that we could listen to him. Thank you so much.
Dr. Sanket, your last words you want to say on this session to our viewers, to our channel?
Yes, first of all, thank you Sandeep ji and Ranjan ji, because just that this single thought, you have come from this mindset of sharing the best what you have got. You can reach out to many people, and each one of here is a gem. They have helped many people at times when they lost their hope, and I would urge each and everyone to learn something, right? If they cannot learn, at least guide them to these platforms, and Spiritual Doctors platform is really a very nice platform. जैसे अपना मोतियों को collect कर रहे हैं, so that we can bring the guiding light and bring health in a less invasive way, right? And have that motherly touch or that love and that expression to the life which is there. Thank you for this opportunity, and thank you all the viewers and all the participants who are here, all the colleagues and seniors definitely for listening so patiently and getting involved in it, right? Thank you so much once again.
Thank you very much friends. आप हमारे साथ इस तरह जुड़े रहिए. हम हर संडे एक नए डॉक्टर को, एक नए स्पिरिचुअल डॉक्टर को आपसे मिलाएंगे. Hope you like this session. With this we are completing our session. Last words from Dr. Saurabh. He will tell about the next week's speaker to us.
स्पीकर के साथ साथ ऑडियंस का भी महत्व होता है. अगर सुनने वाले हो तभी डॉक्टर संकेत को बोलने मजा आएगा. तो आपने 11 बजे से अपना साथ, अपना प्रेम बनाए रखा है. आपके 1.5 घंटे के पेशेंस के लिए आपका धन्यवाद. और ये पेशेंट्स हम आपसे हर संडे चाहते हैं। एवरी संडे वी आर ब्रिंगिंग सम न्यू डॉक्टर, और अगले संडे भी हमारे साथ एक ऑर्थोपेडिक सर्जन जुड़ेंगे जो न्यूट्रिशन पे बताएंगे आपको। तो हर संडे 11 से 12:30 1.5 घंटे का समय हमारे साथ रहिए। और जो भी आपने सुना, जो भी आपको अच्छा लगा, वो हमारे सोशल मीडिया पे कमेंट कीजिए, क्योंकि सोशल मीडिया पे कमेंट पढ़ने से नए लोगों को इंस्पिरेशन मिल सकता है। हमारे यूट्यूब चैनल का मैंने लिंक आपको ग्रुप में, चैट में दे दिया है। हमारे टेलीग्राम ग्रुप और व्हाट्सएप ग्रुप पे हमसे जुड़ जाइए ताकि आपको नोटिफिकेशन हर संडे मिलता रहे। और स्वस्थ रहिए, मस्त रहिए, तंदुरुस्त रहिए। इन्हीं सब शब्दों के साथ आज के लिए नमस्कार।